We all know that the heroin and opioid crisis remains the most pressing public health and public safety issue facing our state. Last year alone, more than 400 Granite Staters died from a drug overdose, with the majority of those deaths caused by fentanyl, heroin, or another opioid. And thousands more overdosed, their lives saved only by the quick action of first responders, of medical providers, or of family and friends. We all recognize the serious threat that substance abuse poses to our people and to our high quality of life, to our businesses, and to our economy. And we've been working together to strengthen our efforts to combat this crisis. Last fall, I called for a special session of the legislature and proposed comprehensive legislation to stem and ultimately reverse the tide of this horrible epidemic and to help save lives. And in January, I signed 2 bipartisan expedited bills. Thanks to that swift action, we're cracking down on fentanyl, we're streamlining access to treatment, and strengthening our prescription drug monitoring program. But we know that the fight is far from over. We must be constant and focused in our work to strengthen these efforts and to give patients, providers, families, educators, and law enforcement better tools to combat this horrible epidemic. Combating the scourge of addiction requires us at times to change the way we've always done things, and at a quicker pace than is sometimes comfortable. And it also requires additional resources and dollars. While there are some who may say that we can't afford to take steps to combat this crisis if they require additional funding, I believe we can't afford not to.